Well, hi, Tony. It's great to see you. I'm super excited to chat today and learn a little bit more about you and your career and what's brought you to the Venturis Network. So we'll jump right in. I know you've led so many teams across all different industries. So for people meeting you for the first time, how would you describe the through line of your career and what's motivated all your work?
Well, it seems that since I was a kid, I had this one question, which was, how does it work? And I took stuff apart a lot. But it's kind of hard to do when you get to the human brain and the human mind. But that's where I began to get very focused, even as early as my teens. And so the sort of the through line has always been the issue of, given somebody has some level of ability or competence or whatever, uh, how is that defined and how can you move that to the next level, such as is desirable? So that might be typically developing behavior, cognitive development. It might be something within education. So you're trying to intervene to make something happen. It might be recovery from or rehab from other situations, or it may be an atypical development where somebody is missing some competence or it's not working as well as it should. And so the whole question's really been, how does this stuff work? What's actually generating the behavior we're seeing? What's missing? And then how would we move that from one level to another? And basically, I've been sort of tackling that question with different methods and different technologies for about 40 years.
Mhm.
So,
And that kind of ties into another question I wanted to ask you because you've spent so much of your career like solving all of these complex problems and understanding people through like technology and behavior, all the things. So how has that shaped your approach in like decision making and your leadership?
kind of let's take those two a little bit apart. So, technology, it's often the case, particularly in the human behavioral and cognitive sciences, that technology actually, as technology advances, the science advances and not the other way around. So, when I was an undergraduate, we didn't even have things like real computers. I mean, this is not the 1700s or anything, but but computers were not that available. So experiments were done with kind of mechanical driven devices with you could do experiments with vision with things called tachistoscopes, which I still don't think I ever learned to spell properly. But anyway, then we got to computers where you could control the rate of presentation. Then we got bigger computers so we could do more sophisticated things. I was involved in the world of AI, both for understanding human cognition and developing machine learning behavior back in the late 1980s when that was kind of the AI winter, the AI summer before the AI winter that followed, but now we're back in the AI summer. So
Mhm.
that massively influenced my thinking because really enabled me to actually answer the problem I've been talking about a minute ago in engineering terms, which is literally what what competences can we build and can we make them produce the behavior? And you could literally, like for any programming environment, actually see if it happened. And then because these were machine learning algorithms, if you let them do what they were supposed to, would they end up in the right place or would they go off track? So you knew you hadn't got it right or you hadn't got it wrong or you got it wrong. And then, we had MRI coming along and functional brain imaging and structural and connective brain imaging. So, and then I ended up in the world of digital therapeutics as the pure way, I believe, the great way to deliver these kinds of treatments that I've been working towards. And even in the thing that virtual reality came along, that is actually one of the most powerful ways to doing things. But this is where you get to the very interesting question about decision making, which is you might have all of the technologies, but you can't necessarily use them or apply them appropriately. So, for example, um, you know, it's very, very expensive to do brain imaging. And so asking yourself the question as you solve these problems, is that even really necessary? And or we develop really fantastic digital therapeutics in virtual reality, particularly for post-stroke neurorehabilitation. Um, it's probably I often refer to it as the ultimate gel cap for delivering digital medicines to the human mind and brain. But very few people have those devices.
Mhm.
So it becomes complicated to build a business model out of those things because, are you going to buy them for everybody? Is the payment methods going to be complicated? And then finally, delivering treatments for neurocognitive impairments such as attentional issues in ADHD that I did with Akili, they're sort of like, well, the mobile device is not optimal. It's got a lot of weaknesses compared to virtual reality, but then almost everybody has one, and so you can download straight to that device. So the delivery, so it becomes this very complicated issue of technology enables a tremendous amount of research. But as you think about the translation to business, you've got to be super smart about how dependent you are on those things. And I've kind of ended up with the decision making sort of strategy of like you need the fewest number of things that are, and they are most be the most available and cheapest. Otherwise, your business model is going to be really, really difficult. So you have to make a lot of compromises in that sense. So it's very interesting because the technology has basically been this massive enabler, and yet it actually turns out to be a potential restriction factor when it comes to delivering the treatments at the other end. And so when you've only been in business or you've only been in science, you don't necessarily see those things. When you've had the rare experience of doing both, like I have, then like, you really have to start thinking about those compromises a whole lot.
Absolutely. I know having done both, you do bring such an interesting perspective to that.
I guess one one comment there is I've made some fairly atypical decisions uh, which has enabled me. I mean, they haven't all been planned for. Very often, I think our junior colleagues tend to think of us as having these kind of straight arrows trajectories from one place to another. And in fact, what we do is we tend to stumble around and end up and life brings you things you didn't really expect. So I feel like I've made some brave decisions to see these things through. Some people thought they were pretty stupid decisions, but I feel like, I've come out being able to pull those unusual sets of things together. And there's not very many people who've got that multiple perspective.
And I know I'd love to hear your perspective on fractional work. I know you're new in the fractional leadership space. So what has drawn you to this model and how are you planning to add value kind of in the space and what you want to deliver in this next chapter?
I am pretty passionate about this issue, actually. And in fact, I made a big case for it from the stage on the final session of the Digital Therapeutics Conference in 2024, the DTX West. The question for the panel was, what's missing in digital therapeutics? And I basically said fractional leadership is what's missing.
Mhm.
And the reason is, so here I am, right? I'm a scientist with my own lab, a senior position, administrative roles, NIH funding, and all of a sudden I go from that to being a startup founder, initially a little bit against my will. Not a decision I regret whatsoever, but
Mhm.
that wasn't the typical direction, as I was saying before. Was a vertical learning curve, right? And then when you're starting a startup, especially one that's going to move into a regulated space with sort of FDA issues and then reimbursement issues and legal issues, how do you run a board? For goodness sake, what are the legal issues of all of this kind of stuff, right? No one trains you to do this in grad school for science, for sure. And as you move forward, we were in this fantastic accelerator called Creative Destruction Lab that I advocate many people should take a look at. And one of the first things they said, this is great, but you really need a fantastically good reimbursement strategy. Well, how am I going to do that? So when you look at this, you realize, okay, we don't have many resources and we're a startup. But there are moments where you might have resources and you've got to have a product lead, or you've got to have a reimbursement lead, or you've got to have a regulatory lead, or you've got to have a financial lead. All right, and the list goes on. There's no way you have enough work for all of those people, and you couldn't afford them anyway. And there's just not enough people with massive exits sitting around with nothing to do, willing to work for free. Of course, you can give, uh, you can give equity out to people, but that doesn't often translate for a very long time if it translates at all. So the way to solve this problem, in my view, is for there to be a whole lot more fractional leadership, right? People like myself and many, many others who've got these areas of expertise who can say, okay, I know exactly what we need to do in this context at this moment for a company like yours. And I can come in and it'll be maybe a finite period of time with a clear amount of commitment, a clear amount of money, so you can budget and you can fundraise against that much smaller amount of money. And then at the end, you'll have this product or you'll have this progress, which you can take back to your investors or to other people. And then, the company probably will move on and look for the next person they need for their next upcoming challenge. So I think it's crucial. I think Particularly, I'm passionate about this because the field of digital therapeutics, as it relates to brain health, has been massively struggling. So I could give you a 2 hour exposition about, and I won't, about why digital therapeutics are the one and only solution to central nervous system problems that we're trying to resolve. Because as I've been saying for 20 some years, you can't swallow behaviors, so drugs by themselves will not ever solve the problem. They're generally, um, someone referred to them as self-dissolving band-aids, right? They work as long as you keep taking them and then they stop. Um, but the brain is an activity dependent organ. And you look at babies, right? You can't you can't inject a behavior into a baby or give them a pill to swallow and suddenly they can speak or something like that. We have to go through experience. It's what's called an experience expectant process or experience dependent process, depending on how it works. And so if you're trying to go back into the first thing I said, resolve a problem, move someone from one level of competence to another, this is really the only way, the digital
Mhm.
therapeutics way. And because you can drive the behavior in the brain, and of course you get this massive data flow coming back, right? So a lot of companies have had very powerful products. I've been involved in a number of them, and they have either failed or commercially not been able to see it all the way through and had to find strategic partners and things like that. The business is very difficult because the business model doesn't fit with our traditional thing. So if you're going to have a long period of time and a big period of challenge, you need as much expertise as you can get for the cheapest price at exactly the right moment. And so I feel like this is crucially important for particularly the world of health, med tech and mental health tech and other kinds of things like that. More than I think more so than in many other indications where digital can be powerful.
Absolutely. It sounds like you've built and guided so many teams through different moments and significant changes through all of this. So, like, what are some principles that you've relied on in moving those teams forward and aligning them in the right direction?
Well, I think it comes down to two words really, which is mission driven, right? So if you know why you're doing this and who you're doing it for, that's probably the most important reason. Um, then you bring the team doesn't need motivation, the team just needs guidance, right?
Mhm.
um, and that also builds culture, tremendous culture in a company. So when I was at Akili, that was the largest company. I was VP of cognitive science there, head of cognitive science. And um, I used to call that I referred to the company actually as a herd of unicorns because it was full of people with these incredible areas of expertise who wouldn't normally work on that, but they were all there because of they had a mission. So when you have a team and you have to have very cross-functional and multifunctional teams because none of these problems can be solved with a single solution. So my other big principle is know what you don't know and find somebody who does know it, learn to speak their language respectfully so that that you're not just sucking them dry, also find
Mhm.
ways to help them. And then it just becomes the whole is so much greater than the sum of the parts. So I tend to think of myself as leading rather more from the side than from in front, because it's like we are all in this together. And the other thing that's been really important, whether it was my lab team when I was, running an academic research lab at a medical center, or a team within my own startup of three or four, or a much larger team, everybody's voice is exactly as powerful as everybody else's voice, right? So we had undergraduate interns in the lab, and very often they said things like, why aren't we doing it this way? And you go, oh my gosh, of course, because you're so used to looking at things the same way. And so I think it's crucially important that if you have to have a multifunctional team and everyone has to realize that they've got as loud a voice and as valued a voice as everybody else. And then I think it almost does it itself. But you've gotta be able to question the kind of conventions and not feel scared to do that or not feel like you could be harmed in some way, emotionally or career wise or whatever. Um, and those things really, that's how I think it really, really works.
Absolutely, especially being on such innovative teams, you're helping create that clarity and that momentum. Sometimes when the path isn't 100% defined and you're moving and growing and changing altogether. So being able to collaborate like that cross-functionally is super powerful.
If you're doing something completely new, there is no playbook, right? So you got to figure it out. And you got to be willing to say, okay, we're going to do this, but it might not work. So we might have to just trash the whole thing and start all over again. And I can think of numerous examples where we had to do that. But if
Yeah.
everyone's mission driven enough and excited, that doesn't feel like a failure. That feels like just solving one of the big problems.
Yeah, absolutely. And in that too, what qualities do you think really set those innovative teams apart from the rest?
Well, I think it does go back to that notion of being there for the mission in the first place, right? Rather than like, so I'll be abstract about this, but I've been part of a couple of teams where there were a few people who felt like they knew more than everybody else.
Mm.
And when uh, let me explain this one without reference to anything specific, but there was a moment where I had a team brought into a meeting which was our primary function, right? And I said, no, we can't do the thing this way. We need to do the thing this other way. And the other members of my team sort of expounded upon that and explained why. And then for the folks that we were dependent upon for the sort of the actual development of that product, one person sort of spoke up and said, "Well, I know what I'm doing here. Why, I think we should do it this way." And thankfully, we had a really good product manager at the time who said, we have a team of people here specifically with these sets of expertise, and they're all telling you why. Why would you think that all of that's wrong and what you know is right, and that's not even your area of expertise? So it can break down pretty quickly, but it can be managed. So
Mhm.
that's a situation where it didn't work, but that was extremely rare, and I found that was sort of really powerful. And again, it's about hiring and it's about culture. And when you have a mission-driven company, people buy into the culture, and that really helps in the way that you can find to hire people. But I want to say something very specific here, as opposed to with innovation within something like um, a digital health, or some kind of med tech, or something like that. Here you have a lot of people with a lot of expertise who are engineers and programmers and also designers and other folks like that, right? And if it's a science-driven company, you have to have the scientists in there, people they're not necessarily often familiar with talking to in a similar situation. One of, without going into exactly why, one of the most powerful ways, probably the only very powerful way to deliver digital therapeutics for the mind and brain, is within the structure of what looks like a game. There's a whole issue of gamification. That's like one of my most hated words in the whole area, but I don't have time to explain why. But the point is, so you have a lot of people who are very, very good. So most people who've built video games of some sort have never dealt with the science of it. I mean, why would they? Isn't relevant, right? Um, and so one of the things is that when you have a scientific role, that's what the product is. You have to have those people in there at the beginning of the process and not at the end of the process. So when I joined Akili, for example, I talked to the most senior leads of different things. I said, look, I need to be there at the first moment of decision making, because the last thing we can afford to do is for your guys to build stuff. And then I say, no, that's not good. Break it all apart and do it all over again. And that creates tremendous ill will
Right.
and waste a ton of resources, which you can't afford to do no matter how big or small the company is. So I think massively innovative teams are not only um, mission driven and cross functional, but understand that they have to do things in very atypical ways from what they might have usually been doing. And if you can get that right, then I think it really does work.
What are some lessons that you find yourself sharing most with other leaders navigating a similar path?
Yeah. So, the one I've probably said more times than I care to even think about counting is that one about know what you don't know, right? Which is sort of an impossible thing, but uh, it's just crucially important that you understand that your expertise is absolutely required in that situation. Otherwise, you wouldn't be there. But that's true of all the other people too, right? And so I'll give you one example. This is sort of a great one where it went from basic science. in when I was at University of California, Davis, and we had a graduate neuroscience group. And the students would come in and they weren't in anybody's lab specifically in year one. It was a general process. And so they did lab rotations. And so if a student came to me and said, I want you to be my advisor, which would be in year two, I would say, okay, great. I need you to go off and do two rotations in areas that have absolutely nothing to do with what we do. I want you to go to a molecular wet lab and spend time there. And I want you to go work with animals or something, right? We were human beings. That's
Hmm.
animals too, but not the same as dealing with mice or rats or primates or whatever. And the reason was because eventually they were going to end up in research labs where they're going to have to talk to these people or product projects, right? And so they needed to know what's that person's life like? What do they know? What they experience? What they don't know? And the same thing when it came down to sitting on a daily basis with game designers and animators and people like that saying, actually, when we deliver this treatment, it can't be like this, it must be like that. And the people that I work with on my team saying, you have to understand how these folks have been trained to think and what they're used to. So that sort of knowing what you don't know and finding people who do, and then learning again how to speak respectfully with them so that, everybody feels like they're getting something out of it. That's huge. My other big one for founders, having lived this, um, and that's why I think fractional work is so crucial, is that I found myself constantly quoting this one statement from the Danish philosopher Søren Kierkegaard, which is life has to be lived forwards but can only be understood backwards. Right? So that's sort of the not knowing what you don't know kind of thing.
Yeah.
And so there are you just don't know what's coming down the road. But if someone's been down that road before you, and fractional leaders have, by definition, they can say, it's not a smart move to do this kind of thing. Let's do this other kind of thing. And so I'll give again a concrete example. When you have a bunch of fantastic scientists who've seen a problem that's translational in some product and they have a solution, they've got a way to do it, and they've got the data to show it, very often their mindset is going to be, this is so good, it's so needed, everybody will want this, right? What they haven't thought about is what is the business model here and what data should I collect? Because the data you collect for a scientific paper is not the same as the data you're going to collect for a regulatory agency or reimbursement or whoever that might be. And so, or investors. So somebody who can say, yeah, that's fantastic, but actually you can't go that way. You have to go this way. So I think that that's really crucial. And that's why, again, go back to the beginning here, that's why I feel like this fractional leadership is so important because I often say startups have too few people, too little money, and too little time. And you can't
Hmm.
afford to make very many mistakes, if any, but you don't know what making mistakes looks like. So you need
Right.
someone to say, that would be a mistake to do that. Let's not do that. Let's do this.
Yeah, that is why it is so great to be able to bring in different types of fractional leadership so they can help you move in the right direction. And I love that quote that you keep saying is help you understand the things that you're maybe that are not in your scope
Yeah,
and help them. And then it helps everyone like grow and be
exactly.
better.
Hmm.
You're thinking about the next generation of work in fractional, in this health tech innovation space that you're in. What are some shifts and trends that you think are really going to stick out?
Well, okay. We cannot get away from AI, obviously.
Hmm.
Um, And that could be fantastic and it could be dangerous and it could be horrible in all kinds of ways, right? I mean, it is unfortunate. I was talking about how enabling tech can be, right? But it's also unfortunate that what we've learned in the last, you know, 20 some years since the beginnings of the iPhone and stuff like that is that you put something out there with best of intentions, someone's going to figure out how to use it for, really awful things. Like, just like all the spam that we get, all the people trying to scam you the whole time. Like, it's almost like we opened up this pipeline for people just like pour stuff at you. So I think that we've got to be very careful, but we could be that this could be very powerful too. And the other part of this is once again tech. And I think that here's the thing, right? We have we don't have a health industry in North America, particularly in the United States. We have a sickness industry, right? We wait for people to get sick. We treat them briefly by playing whack-a-mole with symptoms, generally with drugs, and then we walk away, right? As opposed to figuring out how to keep people on a healthy path from the beginning, and let's just take brain health, right? Um, and and kind of keeping them there as long as possible, and also figuring out who is diverging from that path. Okay. Now, we're I'm wearing two watches at the moment. I have to admit, this is the one I would normally wear. This is one with one of the startups that I'm fractionally a role in,
Oh,
right?
awesome.
And so we are bristling with data collection devices, right? There's these that we wear. People have smart rings. We've got phones, all that kind of stuff. And we are basically pumping out data at an incredible rate. Now, if you have a scientific set of expertise that says this is what typical function within a particular range looks like for a certain class of people, a certain age, certain characteristics, and they have opted in, let's be very clear about opting in
Hmm.
rather than just, stealing the data from them. But if they've opted in, we have this incredible opportunity to actually, with digital biomarkers, so I would say digital biomarkers, although that's actually to me a bit of a contradiction in terms of digital markers, right? Digital measurements of something particularly behavioral, neurobehavioral. Again, I keep going back to digital. I mean, neuro and behavioral is my thing, but actually, it's also the fact that digital devices and our brains sort of are the same class of object, right? They're digital information processes in one form or another. Um, So they speak the same language in some sense. Now, with those devices, with the right science, and it's the same way as delivering a digital therapeutic, you just know what you have to be looking for that is a component of some higher level cognitive function or behavioral function. You can start to track people over a very long period of time from hopefully what's very typical over a long period of time to possibly the earliest signs of atypical behavior. For example, in dementia and Alzheimer's and other folks like that, we now know that there are very subtle behavioral measures you can pick up. And that's the beauty of these digital devices. You can really pick up tiny little subtle things because you're looking at milliseconds at a time. You can see those things decades before anyone actually shows symptoms. And this is true of many neurobehavioral conditions. So if you can track people and you start to say, oh, this person's beginning to diverge from a path, you now have the possibility to think about who to treat, when to treat, how to treat, long before you ever get there. And the other aspect we know with neurobehavioral conditions is the early intervention always is far more powerful than waiting till someone is sick or showing, real clinical symptoms, hard to unwind them. So for me, much as I'll literally say heartbroken by the fact that the digital therapeutics world for behavioral health seems to be struggling into the periphery at the moment just because of the resistance from the medical industry. This other version of it is even more powerful, and you're beginning to see awareness of it within the big tech companies, since they are the holders of most of those devices. There was a huge study by Apple and a couple of pharma companies a few years ago. Google is doing these kinds of things. They have, Verily's got this giant device now, Verily.me, which is a digital device that pulls all your medical stuff together. So you think about the collection of those data with the science enabled by the tech and wise uses of AI to pick up those patterns and extract those patterns and identify people. This could be incredibly powerful for shifting us from a sickness industry to a health promotion world, certainly as far as neurobehavioral health goes.
I love that perspective of focusing on the health rather than the sickness and moving in that direction. I think will benefit so many people. And it sounds like the work that you've been doing is striving to do that. So that's super amazing too.
Because this is very passive and this is essentially very cheap. And you're not waiting. It's like the same thing. Don't let people go to the emergency room. Try to treat them long before they need that because it's way too expensive. And
Mhm.
that it's a big factor in saving societal resources, so we can put them, in better use too.
And as you step into all of this different type of work, as well as stepping into fractional work, what types of problems or strategic challenges are you like personally most excited to help companies work with?
I think it's literally these ones that I've been talking about, right? Which is the fact that um, we have a massive gap in neurobehavioral health and mental health. We know what the massive, uh, challenges are, the crises that have been going on. Um, there's good reasons why there's so much drug development as a solution. Part of that's because it's biologists who are doing biologically trained people who are doing the research, and so they think that biology first is the solution, and that's a reasonable approach. It's a reasonable approach for pretty much every other organ in our body, right? Um, your heart does one or two things, your liver, your kidneys, so on and so on, your blood, right? But the brain does so many things, and your heart doesn't figure out how to do new tricks all the way through its life like your brain does, right? It isn't
Yeah.
figuring out how to play golf or
Mhm.
speak another language or something. So the gap between the biology and the manifest behavior that you care about in the end is huge, and there's so many variables in between, and that's just not the case with most of our other organs. So the notion that a chemical solution can fix the functioning of an organ is very sound for most of the body, but doesn't really work for the brain. This is where I know that digital is so incredibly powerful. So with science from the cognitive neurosciences, psychological sciences, combined with this technology that we have that's everywhere, we have this possibility of sort of developing novel ways of measuring, novel ways of surveilling is a word that people are very frightened of, but basically watching carefully of people to sort of keep them in a better state. So I think that's one huge development that we can do to improve neurobehavioral cognitive rehab, all that kind of stuff. The big challenge is going to be how to fit this into a business model where it's because it's not typical for the way that our medical industry works, right? And so it's all very well having an incredible solution, but if no one will pay for it and no one will invest in it, and I
Mhm.
had to pivot several times away from the things I thought might be the key part of this, because there just wasn't a market or there just wasn't investment. And so in the end, it's very important for people to keep in mind it's got to be a business in the end because every solution, like I often say, the best medicine in the world is useless if no one swallows it because they can't get it or they're not
Yeah.
interested in it, right? So you've got to come to
Mhm.
that solution. So that's our very big challenge. The science is out there, the brilliance is out there, the tech is out there. So putting it all together, but then figuring out how to actually make this commercially viable. Um, and you know, obviously the United States is not the only place on earth, but it gets complicated to deal with other countries because they have different approaches and different legal systems and different insurance systems and so on. I don't think that's not something people should be keeping in mind, but you have to kind of solve your first nearest problem first.
I would love to hear like your perspective and maybe what tips you might have for others who are new into this space and some tips you have having been in like the seat of the startup founder as well.
Okay, let's see. I'm pretty new still to the fractional
Mhm.
role in many ways. I would say that what one things I'm learning is you need to be pretty clear about how much you can take on and how varied that needs to be, right? So you tend not to have so much choice in the beginning. And if you're successful and you can get the word out, you might begin to be able to choose a little bit. So what I tend to think about now is the next thing I select, if I have that freedom and that luxury, is the next closest thing to my area of expertise. Every job that I take on where it's a little outside of my area of expertise. I mean, in the world of science, you can learn the new literature, that's not so difficult, but it's still a lot of work. Um,
Mhm.
and there's a switch cost involved. So everything, rather than having one job, you got to get into the mindset. What was I saying to these people before? Where are we in the process? So
Mhm.
good note keeping is important, but I would say understand how much capacity you have, how much tolerance you have for set shifting and having one different thing from another, and try to, I think, use your expertise as best as possible, um, as close as possible, so it becomes, you feel like you're being the most useful you can be in the most efficient way. I think that's really important. Also, from the other side, this is where the tension becomes. You need to know what your value is, right? But you also need to understand that mostly in this situation, we're dealing with small, underfunded companies. That's the whole purpose, as we said, for doing this kind of thing. So I think being a little bit flexible with your rates and like trying to find out, being really transparent. I mean, being transparent about everything runs through everything I've ever done, leadership and communication, all that kind of stuff. So I think it'd be clear, like figure out, okay, you guys, what is this company? What's your situation? What money do you have when no one will ever know when the next investments are going to come? What can you afford? Um, I can only go this low, otherwise I can't work properly. So we adjust the amount of time that we have. If that's not going to work for you, it's either too expensive or too little effort, then it won't work. But I think, sometimes what happens is you can help a company by being a little bit generous at the beginning. And then if you do your job well, they'll be better off. And you can then, with a clear expectation that we'll review this situation. One of the things I like to do is say, depending on what's going on, like, let's set up for a quarter or a half a year. I find it really takes about half a year to really learn a company, but still, we don't
Mhm.
have that luxury all the time. And then let's have a 360 review at the end of it, right? Do you still want me? Am I still useful to you or not? And also, do I feel like I want to keep working with you folks?
Mhm.
Or
Yeah.
and not, I might love you and think you're the greatest company on earth, but I may not have any more to give, right? It's like you don't really need me at this point, so don't keep spending money on me. I think you have to be pretty clear about that. Um,
Having been on both kind of sides of that, that's really great perspective.
yeah, and I think, well, one more thing I would say from the side of the founder is that I tend to make the distinction between consulting work and fractional work. So consulting is where someone asks me to kind of impart some wisdom and help them out with some stuff. And, we do an hourly rate kind of stuff. I prefer not to do too much of that because I feel like I'm very dissociated from the company. It's also a little bit unpredictable for the founder. So the beauty of fractional, my distinction is, if I'm going to be in your company controlling things or guiding people or having my hands on stuff, then it's really a fractional role. But the nice thing about that is we can say, forget about, an hourly rate. Let's just say this is the effort, this is the rate, and you know exactly how much money you're going to be spending over this amount of time. And for a founder who's always got a budget that's too small and doesn't last long enough, that's really important. Um,
Yeah,
so
that is. That's such a good way to differentiate too for people who are newer in this space and watching this and learning more about the fractional world as a good way to separate the two different things.
yeah,
Mhm.
let's see if it works out for us all.
Yeah. Thank you so much, Tony, for taking the time today to chat and share some more about your experiences and where you see the future of fractional work, health, science, all of those awesome things. It was great to chat with you.
Yeah, thanks so much. I appreciate
Mhm.
it. I really
Yeah, you
enjoyed.
too. Have a good
Okay,
one.
thanks. You too.
Mhm.